السلام عليكم ورحمة الله. أهلا بالجميع، حياكم الله في ITAR ودورات واللقاءات التي تقدمها ITAR أسبوعيا. اليوم بإذن الله تعالى ضيفتنا الكريمة دكتور مي، عضو هيئة تدريس ورئيسة لجنة التطوير المهني لقسم العلوم الصحية بكلية الدراسات التطبيقية وخدمة المجتمع بجامعة الملك سعود، حاصلة على دكتوراه في الأشعة الطبية من جامعة UCD بإيرلندا، حاصلة على جائزة التميز البحثي 2020 من الملحقية الثقافية السعودية بإيرلندا. لها مساهمات نشر بحثية في مجالات رائدة ودور نشر عريقة في التخصص. موضوعنا اليوم يهم جميع الباحثين والمقبلين على أو كتابة البحوث. موضوع اليوم Systemic Review and Narrative Synthesis ويبينار. تفضلي دكتور مي.
السلام عليكم ورحمة الله وبركاته.
حياك الله.
هلا حبيبتي. حابة أرحب بالجميع بويبينار اليوم عن Systematic Review والناريتيف Synthesis. إن شاء الله يا رب الويبينار تكون effective بإذن الله، تكون efficient for you as a student researcher or as a PhD student أو إذا كنت novice researcher. فويبينار اليوم إن شاء الله راح نعرف Systematic Review and why we're using Systematic Review in scientific research. راح نتعرف على main steps of conducting a successful systematic review that help you to publish your review in a peer-reviewed journals. راح نتعرف إن شاء الله على main references that helps you as a researcher in employing narrative synthesis within systematic reviews. وبإذن الله على نهاية الويبينار راح ناخذ few minutes for your questions and inquiries. بس قبل أبدأ حابة أتأكد إنه إن شاء الله الصوت واضح.
أي الصوت واضح تمام.
تمام، حياكم. طيب. What is a systematic review? Usually the systematic review is the top evidence of hierarchy evidence in scientific research. As much of us knows that randomized control trials or RCT are the top evidence or the strongest evidence that we found in scientific research. The good news in systematic reviews will provide the strongest evidence, even stronger than RCTs, and that would be predictable because you're usually within systematic reviews, you're collecting the articles or collecting scientific results and scientific research, and you're appraising and critiquing this research to find an answer for a particular question in research. So it's like you're finding the strongest of strong evidence found in literature. You're summarizing these evidence and you're actually critiquing the evidence to provide the best evidence found within your topic or within your research. There are simple differences between systematic review and literature review, especially if you are a PhD student. I guess that difference would be helpful for you. The systematic review usually looking for best evidence, as we said. However, the literature review discussing the available literature. In systematic review, you usually decide like a particular question, a particular angle with your research, and you're looking for a clear answer based on searching the literature. You're providing evidence based on the evidence found on the literature. You're usually looking for best evidence. You're usually looking for best answers. You're appraising your answer if it's strong or weak, and based on your results, you're going to recommend or show the limitations of these answers. However, in literature review, you're usually just discussing what is in there in literature. You're discussing just the knowledge aspects of your research. the studies that covered in literature regarding to your research. You're not looking usually for the best evidence, or you're not usually also critiquing the studies for your literature review. And systematic review, as I said, requires appraising the literature, requires critiquing the literature. However, in literature review, you don't need a systematic appraisal for the studies included within literature. In systematic review, you need to conduct, or you need to use appraisal tools, valid and strong appraisal tools, which are well known in scientific research. And during this webinar, I'm going to show you what the most famous appraisal tools used to critiquing articles for scientific research. In systematic review, you should include 2 reviewers at least. Unfortunately, you cannot publish your systematic review if you just write it alone by yourself. You really need to include 2 more reviewers, 1 reviewer or 2 reviewers in your systematic review, in order to reduce the risk of bias, in order to increase the objectivity of your evidence that you worked on within your systematic review. However, in literature review, 1 reviewer is totally acceptable and is enough. Usually, if you need to publish a review, I recommend to use systematic review approach. It would be more stronger than literature review. It would increase the chance of accepting your review for publication. Some literature reviews can be accepted for publication, but really in a very minor way. I think just if you have very novice aspect of research. For example, if you're working in information security and you're doing a literature review in Internet of Things, and I remember one friend in PhD was doing or was covering the information security aspects of Internet of Things, and such a project was quite novice in scientific research, so would be quite enough to conduct literature review for that. However, if your aspect of research is quite broad and it's been there for a while in literature or in research, I guess you need to do systematic review. It would be like more effective for scientific research to be published. Before explaining the main steps of conducting a successful systematic review, you need first to register your systematic review in Prospero database. It's International Prospective Register of Systematic Reviews. It's in the University of York in the UK. The main concept of this website or of this database is to register the topic that you are working on, to register your review question, to tell all the scientific research environments that you are working in such a topic. So you're going to avoid any replication. Nobody going to work on such topic that you are working on until you finish it. You're going to introduce your protocols you're using within your systematic reviews. You're going to explain your big question. You're going to explain the criteria you're following within your systematic review within this step in registering Prospero for registering your systematic review. What would help you to formulate these protocols or methodological protocols for your systematic review is Prisma Checklist or Prisma Guide. It's a referred report, items for systematic reviews and meta-analysis. The good news, even if you're not using meta-analysis, just in my case, I didn't use meta-analysis and I really use Prisma Checklist, and it was really effective for me within my experience and was sufficient for me to register my review in a Prospero. We have many guidelines to conduct I can say a successful systematic review. You can use Cochrane-based guidelines, but Prisma, I found it like much easier, much approachable. The steps very clear with the Prisma. It's easy for the first stage for you if you're a PhD student and you're still novice in scientific research. Prisma is really easy and it's really approachable and easy to follow. Once you registered your systematic review within Prospero, you're gonna follow these 7 steps. Okay, I'm summarizing here the main steps of using or of conducting a systematic review, starting from formulating your review question using PICO model. Then you're gonna search the databases for articles. Then you're gonna select these articles based on the selection criteria that you already determined during PICO model phase. After that, you're gonna extract the information from these articles to answer the PICO question. You're gonna appraise and critique each included article within your review. After that, you're gonna synthesize your evidence and discuss them based on the information that you collected from these articles to answer your review main question. The critical aspect in systematic review is that you need to reduce the risk of bias as much as you can. You need to reduce the subjectivity. You need to increase the objectivity of your reviews. That is not biased to just your own opinion or not biased to your own preferences. How to reduce this risk of bias? That's why we are needing to include a second reviewer within our review process, and you're going to include this reviewer in selection phase. And during explanation of these steps, I'm going to show you how to include the second reviewer. The first step in conducting your systematic review, formulating your review question using PICO model. PICO stands for population, intervention, comparator, and outcome. At the first, you need to determine your population. You need to determine your participants. Are they patients? Are they healthcare practitioners? Who's your population? Is there any particular characteristic for your population? Do they have a particular age? You need to determine it. Gender, are they female or males? You need to decide your population at first. Then you're going to decide the intervention, the exposure applied to this population, the type of medicine or medications, any type of training program, for example, any intervention applied to the population. You need to decide the control group, the group who does not go through the intervention. And finally, you're going to determine the outcome, the measurements that play a role in answering the review question. Whatever was the outcome. For example, we can say like the population was the children and we give them a certain dose of vitamin D. We're going to compare these groups with a control group who doesn't receive vitamin D. The outcome, like the physical activity of this child, does increase or decrease, or there is any change or any impact on their physical activity. Another example I'm going to provide you here based on my study or my review article. My population was sonographers, for students, trainees, novices, midwives, fertility specialists. Any participant or participant that has an access to ultrasound and who not having previous experience in using ultrasound, like novices in using ultrasound. These were my populations actually. For intervention was the simulation or the simulator, the ultrasound simulator. El comparator, all studies on the role of using the simulation in education included whether or not they involved comparisons within control group. This aspect of research was quite new. It's kind of novel, it's still new there in scientific research, and most of the studies were made without control groups. So for me, it was really important to include all studies, whether they comparing with control group or not. And that's totally acceptable within using PICO model for systematic reviews. The outcomes was all the skills or all the outcomes that influence learning ultrasound skills using simulation. So the PICO question was, what is the impact of simulation-based training on learning ultrasound skills for novice practitioners in ultrasound? The simulation was my intervention. Learning skills was my outcome, and novice practitioners was my population. Based on your PICO question, you're gonna formulate the selection criteria table. You're gonna determine with this table your population, your intervention, your outcome. You're gonna determine the inclusion and exclusion criteria. That helps you determine which article should be included or which article is relevant to your review question. You can determine the type of study, you can determine the design. Some articles or some reviews just looking for RCTs and they're excluding other types or other designs of studies. And it usually depends on your aim of your review and the angle that you are covering in your review. In my situation, I include only the scan trainer, such as simulation, sonar simulation that I need to study on. And I excluded all other types of simulation. So it really depends on what you are looking for to formulate your selection criteria. After you finish the step of PICO question and you already determined your review question, you're gonna start with search strategies. You need to detect or determine your search term. You need to determine your search databases, and you need to record or report your search instructions. Within search terms, in my opinion, the most efficient and effective and easy way to determine your search terms is using mesh method. And I recommend using such a method. It really gives a strength to your review. You're gonna put mesh on Google and you're gonna go to this database. It's a US national database, and it's a very famous database that contains PubMed database, well-known database in medical field. You're gonna select mesh and you're gonna write here the word that you're using for your search. In my situation, I use ultrasound. And when I click on ultrasound, several definitions comes for this word. Ultrasonography, ultrasonics, diagnostic imaging. I selected the definition that represent what I mean exactly. For example, ultrasonics was referring to physics. Diagnostic imaging was more broad, and ultrasonography represent what I mean from ultrasound. So I selected this option. When I selected ultrasonography, several synonyms comes with this phase. You're gonna go through these synonyms. You're gonna select the synonyms that you need for your search. And the last term would be ultrasound or sonography, etc., and simulation or simulator or interactive learning. I found interactive learning as a synonym for simulation in mesh method. And if I just used my subjective selection of synonyms, I might not come with such a term. There is another method. Some researchers recommend to use PICO model within determining the synonyms for your research. You can add here synonyms or different synonyms for population. You can add different synonyms for outcomes, and it really depends on your search. If you just add, in my case, I just end up with the intervention, and I found it really adequate and enough for me in my situation. If I added population and outcome, I would limit my research, and maybe I'm going to end up with very limited citations for my research. And it really depends. Maybe if you just put, or if you choose just the simulation or the or the intervention synonyms without outcomes or without population, you may end up with very broad citations and articles. You could find like more than 2,000 articles, and that's really time consuming and could be inefficient for you. So in this case, you need to add other synonyms for population just to limit your search results as much as you can. When you determine your search terms, you need to determine your search databases. And the most easy way for me was to look within the previous systematic reviews in my field, to read these systematic reviews and to find which databases they used within their reviews. You can use this book. I found this book really, really effective and really efficient actually for conducting systematic review. It's easy to follow. They provide different tables of different databases based on the scientific field of research. I found different databases in medicine, in education, in social science, and I really recommend using such a book. You can ask your librarian, you can ask your supervisor, any senior researcher within your field. He would be able to help you to find suitable databases for searching. When you start your search, you should record any search restrictions you used. You might limit your search with English language citations only. You might limit your publication date. Any restrictions you already use within your search, you should report it, as it would be required to be mentioned within your methodological part of your review or of your article. Study selection. The next step or the next phase. You already determined your PICO question. You already determined your search terms and search databases, and you want to start searching for studies to be included within your review. The first step here is to use the selection criteria table that you made in the PICO question phase. You're gonna go through the articles one by one based on this table. You're gonna select your article based on the population, on the intervention, on the outcome, based on the inclusion and exclusion criteria that you already made at the beginning. you're gonna start title screening at first in each database. Screen the titles, then you're gonna screen the abstract, and then you're gonna screen the full text. When we use the second reviewer with us, with abstract screening and with full text screening, it's really hard to find another reviewer to cover this phase, the title screening, as it's really time consuming and it's quite hard to be managed actually. However, if you include a second reviewer with these phases, abstract and full text screening is totally acceptable and you can publish your article. How to do title screening? You're gonna go to each database. Okay, search the first database, record the number of citations you found. When you put the search term within your database, you will find many articles as a search result for you. You should record or you should report the number of these articles. These numbers, we need them later. I'm going to show you where to report them. But when you go to each database, you need to report each number of articles you found in each database. You also need to report the date of search that you made. So record the number of citations or articles, then screen the titles of these articles based on the PICO selection criteria that you made, based on the exclusion and inclusion criteria that you made at the beginning. Select the article that you found relevant and save them in any citation reference tool. For in my case, I set them in EndNote. Then repeat these steps within each database. Once you saved the articles in EndNote, you need to record and report the number of these articles, the number of selected titles. Then you need to remove the duplicates, because normally you're going to find much articles or most of these articles were duplicated. So you need to remove the duplicates, and you have such a feature within EndNote to remove the duplicates. And you will find the citations decrease by half after this step. Then you need to record the resulting number of these titles. I'm going to show you where these numbers, we're going to use them within reporting this systematic review. Once you finish your title screening, you're going to invite the second reviewer using this software. This is not it's a helpful step to use in Confidence. It's not necessary to use it, but I recommend to use it as it's really make the process of selection, the studies very easier and approachable between you and your second reviewer. You can find this platform in Google. You can register, you can upload it to your desktop. You can report your review question within this platform, and you can put on also all the selection criteria. You can import the citations or the articles from EndNote. You're going to invite the second reviewer, and you both will go to the articles one by one individually, and you both have a tool or an option to select or exclude the title or the article based on the selection criteria formulated by you. Okay. You're gonna do it individually. And once you select your article, you will select in this phase, you're gonna screen the abstract. Both of you are gonna screen the abstract, both of you are gonna select the relevant articles, and when both of you finish this step, some abstracts will be shown here, actually, in this software, showing if you have any disagreement. You need to discuss about these abstracts and decide if they are included or not within your review. And if you both disagree, you should ask for third reviewer to vote, and you should take their decision. You repeat this step also with full text screening. Okay. The number of citations or articles that's reported before at the beginning, you need to fill this flow chart. You will find this flow chart with the Prisma supplements. You're gonna record the number of citations or the number of search results you collected from all databases you searched. You're gonna record the number of citation after title screening and after removing duplicates, etc. By this stage, after you collect all your studies and you determine which studies included within review, and you finish the analysis stage, and you answered your big question, you can publish your article. But if you are a PhD student, you might finish this step 2 years before you're submitting your thesis. So you have like 2 or 3 years gap between finishing your systematic review and submitting your thesis. You need to fill this gap with repeating the search steps. You need to search. Like in my example, I finished my systematic review in 2017, so I repeated the search strategies from 2017. I got the restriction time from 2017 to 2020, and I found 3 more articles. This step is really important at PhD level. Otherwise, you're going to be asked by your examiner about the gap of literature in these years. You finished selecting the articles. You already including all the articles that you found they are relevant to your review. You're gonna start to extract information from these articles. And the information that helps you to answer your review question. Okay, how to do this step? You need to formulate a table. We call it extraction sheet. And you need to determine the columns of this table based on what you need or based on what would help you to answer your review question. For example, in my experience, I made the table at the first stage with many columns, maybe 7 or 6 columns, 6 aspects. I collected data regarding the methodologies, regarding the statistical analysis, etc. But when I go through reading the articles, I found just these 4 columns are enough. You need to minimize error within this step. You need to discuss the risk of bias within this step. The good news, you do not need another reviewer in this step to discuss or to eliminate risk of bias or to eliminate error within this process. You can just say that you piloted this information sheet within 2 or 3 articles. You've already made a table with different aspects. You piloted these aspects within 3 articles. And finally, you select only 4 aspects, for example, or 4 columns, and that you found them efficient for you to answer your review question. So you adapted that table and you change that table based on this pilot of 3 articles. And that's totally acceptable, and that's actually strengthen your review paper. You also need to report the characteristics of the articles you collected. How many articles you found, who are the authors, where they made, what were the designs, what were the outcomes, all the characteristics that you found them really important to explain your review. You should report them as you are describing your data. Actually, your selected articles are your data for this study. You finished the extraction sheet. You already formulated the question. You made the search, and you made or you finished the extraction phase, information extraction phase. Then you need to appraise the selected studies. You need to critique them based on valid tools for study appraisals. You might take a screenshot for this. Study appraisal tools, I think these are the most famous appraisal tools used for scientific research. We have here Cochrane, Risk of Bias, Consort, CAST, and Pedro. And I guess these usually used for RCTs studies. We have Strobe, usually used for survey studies. EPHPP used for quant studies. Actually, CAST also has many tools and different tools used for quant studies or qual and any other designs. I guess they might have a tool for surveys too. All these tools are approachable, and you can just name these tools on Google and you can go immediately to their website to upload their tools. In my case, I use EPHPP, Quality Assessment Tool for Quantitative Studies. It's effective public health practice project. I found this tool very easy to follow. Actually, it's really approachable. They're explaining how to rate different aspects within one article. They're explaining how to vote the strength or how to rate the strength of each article. For example, when just you finish rating these aspects, you can rate the whole paper based on the results of these aspects. If you have a paper that has no weak rating, that means the paper is strong. If there is 1 week rating, the paper is moderate. And if there is more than 1 week rating, the paper would be weak in terms of its methodological strength. I use also CASP for qualitative appraising or for appraising qualitative studies. This is also really easy tool to follow. They explaining how to appraise or how to critique the papers that you're collecting, you already collected before. They're telling you that if you have around 75% of yes answers, the paper is strong. And if it's less than 50%, the paper of your article or the paper that you worked on is weak in strength. And of course, between 75 and 50 is moderate in strength. Once you finished your appraisal phase, you're gonna record or report the results in a table. Each table represents each tool. In this table, we presented the first tool, EPHPP, and the second table represents the results of the CASP tool. After that, you're gonna synthesize your evidence. And this is the step, the core step of your systematic review. This is the heart of your systematic review. You're gonna synthesize your results. And also you're gonna evaluate the evidence that you collected from your articles. And now we're gonna show how You synthesize and evaluate the evidence. To synthesize your results, you first need to check on the designs and outcomes of your selected articles. If all have the same design, methodological designs, and the same outcome, that means you're going to use meta-analysis approach. But if they have different designs and have different outcomes, like in my experience, we had different RCTs studies, we had cohort studies, qualitative studies, we had different themes and different outcomes. So we used narrative synthesis approach. So the type of selecting studies, the nature of selecting studies will determine which approach you're going to follow within analysis. You're going to also use meta-ethnography in case all studies you collected were qualitative study. For today, we're going to talk about narrative synthesis. So what is narrative synthesis? It's a form of storytelling, an approach reliant on using words and text to summarize and explain findings of studies included in a systematic review. The best reference that I recommend, if you can have a screenshot of this reference, is Cochrane Consumers and Communication Review Group. It's actually informative reference in how to employ narrative synthesis. It explains the situations in which you need to use narrative synthesis, and mostly when we cannot approach or we cannot employ the meta-analysis, we're going to use narrative synthesis. So in short, narrative synthesis relies on analyzing the information collected from articles based on using thematic analysis. You're going to build themes of the results of these studies. You're going to need to find the relationships between these results, between the data collected from these studies. If there is any similarities or differences, and you need to explain why, if there is any differences between the results found within your selected articles. The last step, you need to develop a framework of your results. And this framework relies on the aim of employing such a review. So what was your aim? Is your aim to find the gaps in literature? Is it your aim to explain an intervention or explain the way of using an intervention? So it depends on what you want to tell. It's your story to tell. What you wanted to tell. You're gonna build a framework, and I'm gonna show you in a few minutes the framework that I built within my study. So the first step is thematic analysis. Maybe qualitative research is more familiar with the concept of thematic analysis, but if you didn't get a chance to do thematic analysis in a simple way, you need to go through your extraction sheet. You need to go through all the results and make themes based on these results. You can make themes based on the outcomes of these results. You can build sub-themes. You can categorize them to other themes. You can find the similarities between these outcomes and similarities between these findings and give them a theme or a category. For example, this is my experience within thematic analysis at the first stage of my PhD. I really use just a simple way of handwriting. You can use NVivo, you can use Maxcoda. I think the other software there are many softwares can help you in coding and building themes for texts. You can use them. You can use handwriting whatever the way you are using, you just use the best formula for you that helps you to create the themes of your studies. I remember when I went through the review studies, there were many statements and there were many evidence comes from more than study. So I just categorize them. I just report the studies that I found such an evidence with, and then I build them in 4 final themes or 4 major themes. So these themes gonna explain what is there in literature in terms of my field or the field that I'm working on. After you synthesize your evidence or your statements that represent the results of the literature, of the collected studies, you should evaluate this evidence. In simple way, the evidence will be strong, or the statement you're saying will be strong if it comes from multiple strong articles. They're going to be moderate if they come from multiple moderate articles. The evidence would be uncertain evidence if it comes only from one article or the findings were inconsistent between articles. The findings were different. Such an article says something and another article says the opposite. So such an evidence would be uncertain evidence and no evidence if there is no study for an outcome that you are looking for. Why we need to evaluate this evidence? Because you need to build your recommendations and your limitations based on this evidence. For example, in the case of uncertain evidence, you're going to tell the literature that this evidence not covered, we can say inadequately, actually, and we might need further studies to cover such evidence. Some studies say this and some studies say that, and etc. In this scenario, like the evidence that I collect, I already wrote the rating of this evidence based on the strength of the articles. For example, this was a B level evidence, and it comes from 2 moderate articles and 1 strong article. The last step is to formulate your framework. And this is an example that I worked on within my article. I just wanted to show the reader what is there in the literature, to show the main themes come from the literature that I searched in my topic, to show the main evidence that comes from analyzing these studies. You can build another, as I said, you can build another framework that explaining the intervention or explaining the aspect that you are looking for, the answer that you are looking for. It really depends on what you want and what you need to explain for the reader. The idea or the concept of building this framework is to help the reader to know everything about your systematic review just in one figure, to understand what you are trying to tell within your systematic review. The last step is discussion, how to discuss your results. If you found a clear answer to your review question, you're gonna start your first paragraph with a brief description of your studies and their characteristics and a clear statement about the real answer or a clear answer of your review question. In my case, I didn't have a clear answer. Only 20% of the selected articles were covering the answer that I'm looking for. So the main aim of my discussion was to show everything available in the literature. So I just made answering the question in 2 paragraphs at the last part of my discussion. I started with a brief description about the studies included in my review. I introduced the main themes that come from analyzing these results or analyzing the studies, and then I discuss each theme one by one. So it's mostly the discussion section had 4 subsections. Each section represents a theme. I introduce the theme and I gave the statement about that theme. For example, I said that there is a strong evidence, which is that blah, blah, blah. And then I provided supportive results based on the articles that I found. I gave the statistical results for these articles and discuss each evidence within these paragraphs. After finishing discussing your evidence within your first paragraph, you should tell the reader your voice within this review, what you are looking for. You need to tell them what do you recommend for in the scientific research, actually, or for any future researchers. You need to determine the limitations in such evidence you found. And the tricky thing is that you can find these limitations within these articles. And themselves, you can find in each article limitation, which is clearly stated about that article, and also their future recommendations. And you're gonna not repeat, but you're gonna tell them or inform the reader again about these limitations based on the evidence that you found. Okay. So I guess that was all the steps. I hope it was clear. I hope it was informative enough. In my experience, I used these books. I used doing a systematic review. It's a student guide. You can find this book in Amazon. It's approachable. I don't think it's expensive. I think it's really an approachable price. In case you want to reference a book, I recommend Systematic Reviews in the Social Science. This book is really a very strong academic book to reference. I don't recommend to reference a student guide within your article or within your thesis. You can have, or you can capture this screen for the references that help me to employ narrative synthesis. I found these references really informative and clear and excellent to follow. Yes, I guess that's all for today. Thank you very much for your listening, and I'm happy and glad to answer any question you have.
Thank you, Dr. for this webinar. And if any questions, I think
Even in Arabic, حياكم الله جميعا.
في سؤال من فاطمة القطان. أعتقد لو تعيد، هي سألت على جزئية أنت يعني خلصتيها، فممكن هي تعيد السؤال. أنه سألت كيف ممكن نعرف إذا كان قوي أو ضعيف على جزئية معينة.
كيف أعرف إذا كان قوي أو ضعيف؟ الارتكل قصدكم أو الإيفيدنس؟
أيوة، إذا فاطمة موجودة ممكن تعيد السؤال بطريقة أوضح.
أوكي.
كاتبة خلال ال EPHPP.
أوكي، قولوا كيف راح نسوي الريتنج في ال EPHPP. طيب هو غالباً التول نفسها توضح لك طريقة الريتنج وكيف إنك تقومين أو تنشئين الريتنج. هو يشرح لك تقريباً كل جزئية، بس إنها هي راح تاخذ معنا وقت إذا إحنا رحنا لها step by step. just 1 minute، خلينا نرجع لها بسرعة. يعني إذا رحتي على جوجل حطيت ال EPPHP راح يطلع لك نفس التول، وراح يطلع لك supplements تشرح لك كيف تستخدمين التول. هي جدا سهلة، ما عندك أي مشكلة. راح يشرح لك مثلا السلكشن بايز اللي موجودة في الارتكل. هي فكرة التول هذه تقول لك هل الارتكل هذه قوية أو لا. كيف أعرف إذا الارتكل هذه قوية؟ if they followed strong criteria in terms of selection bias. يشرح لك إيش يعني selection bias ومتى تكون قوية ومتى تكون ضعيفة. يشرح لك study design، أي study design راح يكون قوي وأي study design راح يكون ضعيف. أنت بس تمشين عليهم one by one وراح تعرفين كيف تسوين rating لكل واحدة، ولما تخلصين rating من كل واحدة راح تمسكين أوكي، راح تمسكين ال all ratings هذه تتأكدين هل هي خالية من الويك rating. إذا هي خالية من الويك فما عليه، خلاص عندك الورقة قوية. إذا فيها 1 week، ونفس الشيء شارح لك ذا الكلام هنا، إذا فيها 1 week rating الورقة راح تكون moderate، وإذا فيها أكثر من 2 week ratings الورقة راح تكون ضعيفة. كان هذا المقصد من السؤال، إن شاء الله أكون وضحته.
الله يعطيك العافية. في أي سؤال أو استفسار يعني آخر ممكن على ال Q&A أو على الشات، أو اللي حاب يعني يفتح مايك يعمل raise hand. طيب الله يعطيك العافية دكتورة مي، وصلنا لنهاية لقاءنا الجميل. طبعا نشكر الحضور الكريم ونشكرك دكتورة مي مرة أخرى. لقاءنا القادم إن شاء الله بيكون مع دكتورة حنان المولى عن السرقة الأدبية. شكرا لكم.
شكرا للجميع، شكرا لحضوركم، وشكرا على الاستضافة دكتورة أحلام ودكتور أحمد، وإن شاء الله لنا لقاء قريب بإذن الله.
الله يعطيك العافية، شاكرين ومقدرين جهودك معنا دكتورة مي.
هلا بك.
شكرا دكتورة، شكرا، الله يعطيكم العافية، شكرا جزيلا، الله يعطيكم العافية.